here we are again.
Oh, hello, Badger. How's he doing? All right?
Yeah, he's doing okay, but, you know, the lump's really big now, so I think...
See, can't you?
Yeah, I think it's kind of decision time, so I'll have a chat with Scott.
Oh, do you want to take a seat?
Yes.
He'll be right with you. Just let him know you're here.
Thanks, love.
All right.
Hi, Sarah.
Hi, Scott.
Hello, Badge. How are you, mate? You all right? You're a very happy boy today. Goodness me, I can see why you've come in.
Yeah, it's not slowing down.
It is not. It's quite monstrous at the moment, isn't it, mate?
All right, all right,
Yes.
all right.
Oh, was that a bit tender?
Come
oh,
here.
Bless you. Come on, let's keep the happy boy, hey? The waggy tail's what we want. Come on then, Badge. You're going to come this way? Come to the consult room? Come on.
Boy.
Good boy. Well done. Good lad. Didn't you come? There we go. Well done. So it's been a few weeks since we've seen each other, and unfortunately that has grown, hasn't it?
Yeah, it's definitely, it's not slowing down.
No. And how's he being affected by it, do you think?
Well, I think slowing down, he's, you know, he's not as inclined to sort of go for a walk as much as he was. You can tell it's just really cumbersome and it's awkward. He's finding it hard to find a comfortable spot to sit down.
This is a massive tumour that's really pulling his weight off to one side, which will be affecting his balance, will be causing an increase in arthritic development in the back legs. There's a lot of negatives to this thing, besides the fact that it's stretching the muscles that it surrounds and causing him discomfort.
He still wags his tail whenever anyone goes near him. He still wants to go for a walk, albeit a short one. So I feel like we're doing him an injustice if we just leave it.
OK, well,
But
let's...
it's a hard decision.
It's a very hard decision, really. It is, and we flip-flop about it constantly whenever we see each other, don't we? This is not the first time that we've considered removing Badger's tumour. It's a slow-growing sarcoma, which is a malignant type of tumour, but it's one that doesn't tend to spread. It just continues to regrow in the same site. Now, unfortunately, the size of this tumour and where it is means that we can't ever remove it completely. So, unfortunately, it keeps growing back, and this is now the third time that's happened. So I think what we might have to do is just pop a muzzle on him. All right, champ, it's Hannibal Lecter time.
Yeah, come here, Badge.
Come on. So he's a gentleman until he's challenged, and then he turns into a bit of a beast.
Yes.
Don't you, mate? Hey? No, you just know your own mind, don't you? Yes. OK, you ready, Sarah? I'm gonna pop him up.
Want me to lift or you?
Oh, we'll go. Oh, good boy, good boy, good boy. Wow. This tumour is absolutely huge. Sort of see it coming out from his chest. It's almost like he's got an udder, isn't it? Like it's just...
It's like a cricket ball, isn't
Yeah.
it? And it's sort of that hard as well.
Yeah, it's huge. There's positives and negatives.
Yeah.
But I think the thing is that he is a lovely, otherwise healthy family dog.
Yeah.
Except for this. So if I can rid him of this one last time and give him the, you know, old age, genteel life in Richmond that he deserves, well, I think he deserves it.
Yeah.
Yeah.
The worst thing would be for him to not come through surgery. I think, you know, we haven't got a choice now. He's just, you know, he's in too much discomfort. I think we've got to do it. So, yeah, I am worried. Cheerio, Boise. Be good. Come through it. OK. All right, thank you.
OK, love to you and the family.
See you later.
All right,
Bye.
see ya. Bye.
Bye.
Say bye, Mummy. Say bye. Oh, I know. You've got to be such a brave boy. Yes, you do.
Can't you?
In Isleworth, John is arriving at the clinic with a lost kitten.
Hi, I've just found this kitten in a bush.
In a bush?
Yes.
Nurse Lily is on reception.
Basically, I dropped the kids off at school, and as I was going back to get in the car, I could hear this meowing in the bush. I had a little rummage around and eventually found her sort of 3/4 of the way up this bush. Just a little ball of fluff, just crying away and a bit dishevelled, as you can imagine. She looked like she'd been stuck there a little while.
So just in a bush on this road?
Yeah, literally just 200 yards down the road there.
What we can do is check her for a microchip and just see whether she's got an outer out there who's missing her.
OK.
If you just hold her for a second.
Yeah, no problem.
The little stray that John has brought in is adorably cute. I think she probably does have an owner out there somewhere because she's in quite good shape and she's very friendly with people, and a lot of strays generally aren't. But if we don't have a microchip, it's going to be really difficult for us to find that owner, but we'll give it our best shot. Right, here we go. So we make sure we check all over because they can move.
OK.
Hey, missus. Doesn't look like she's got one, unfortunately.
OK.
What we'll do is we'll keep her downstairs and then we'll get our vet Phoebe to check her over and make sure she's all OK. As a stray, what we have to do now is keep her for 7 days, and then we put a poster in our window and we'll pop her on our Facebook group as well.
Lovely. Thank you.
Thank you. And hopefully her owner will come forward in that time. If not, we'll start looking for a new home for her.
OK, lovely. Thank you very much.
No worries. Bye-bye.
Bye.
Any strays that turn up at the clinic are given a full health check.
Hi, Phoebe.
Hey.
Hello.
Oh, who's this?
This is a little kitten who was found in a bush up the road.
What, it was a stray?
Yeah, a member of the public just brought it in.
Oh my God, it's
I
purring.
know. I think it's a girl, but I'm not sure.
Oh, let's have a look then, shall we? Yes, it's a girl. Yay! She's young though. She must only be about 3 or 4 months. Lily brings down the cutest little kitten downstairs. I can't believe that it's a stray.
Phoebe is now going to look for clues about the little kitten's age or history.
Little baby teeth.
Definitely young then.
Definitely young.
She also wants to make sure it has no underlying health issues.
Considering that she's literally been fished out of the bush, we'll just give her the full health check over, the eyes, the ears, the nose, the check in the heart and chest. What's that? That all sounds fine.
Did you hear anything under all that purring?
Just about. Overall, she's in really, really good health. She's a bit hungry, as you'd probably expect, but that's something we can easily fix.
Yeah, she's already chewing on my fingers.
Let's get you something to eat, Poppet.
Come on then. Phoebe's had a good check over of her and there's absolutely nothing wrong with her. You're very hungry, aren't you?
The little kitten will stay at the practice, and hopefully her owner will be found soon.
What do we think of this? You think that will find your owner?
Hi, team.
Hey, you're...
Hey, yes, so... Badger's back, Nath?
Yes.
He says with a worried look in his eye.
He's a really sweet dog, but just not the best patient.
Agreed, hence the muzzle.
At Scott's Richmond clinic, Badger is about to undergo major surgery to remove the massive tumour growing on his chest.
Reagan, I don't know if you've met Badger.
No, I have not. That is crazy.
Yeah, it's not his most attractive feature. He's a champ. No. Unfortunately, I'd love to say that this is the first time we've removed it, but it's actually our third.
Oh, really?
Yeah, it's a slow-growing sarcoma. It doesn't actually spread anywhere else in his body, but just continues to want to live on this side of his chest. And you can just think how taut. It's so tight, you can feel it.
Yeah.
And so it's stretching all those muscles, and that's what's so uncomfortable. That's why you're panting all the time, aren't you, mate? Because you're just a little bit low-level uncomfortable all the time.
Oh.
So this time, third time lucky.
Wow, look how vascular it is as well.
With Badger's fur shaved off, the huge scar from his 2 previous surgeries is clearly visible.
Right, here we go.
It's the line Scott is using to go in for a 3rd time.
It has some semblance of being fatty, but it's granular. It just doesn't have any structure. I mean, once you get your finger, look, I mean, it's just soft. Going in to remove this tumour, it is just hideous. It's just everything that you would think would personify cancer. It has no structure to it. It pulls out like kind of wet porridge. There's a lot of blood supply to it as well. It's just huge and it's just horrible.
The nasty tumour is especially confronting for Scott's new nurse, Reagan.
No, I didn't expect it to be... Well, I don't really know what I was expecting, but not...
Not this.
Not this, no.
No.
No, not quite.
Yeah.
20 minutes into the surgery, Scott is becoming increasingly concerned.
Badger's actually losing quite a bit of blood removing this because it's just so vascular. It's within all the muscle layers of the chest, and we can't control it because the blood vessels there's no rhyme or reason to them. They're not growing in the normal way. So I'm just doing my best to remove as much of the tissue as quick as possible. But it's a little bit nerve-wracking at the moment.
After 25 minutes, Scott has removed as much of the tumour as he can safely manage.
I'm gonna pull out, close it up. I've got as much out as I can.
But suddenly,
Have you got a heartbeat?
Badger's condition starts to deteriorate.
Oh, yeah, I have got one. It's not very strong.
Yeah, I just need to keep a very close eye on that. Okay, just have a listen that he's definitely got a pulse still. Reagan, put your hand underneath and feel the femoral pulse.
I'm not sure if I'm feeling...
Can you just get James for us?
Yeah,
just go run into the sauce, James.
Okay, just have a listen that he's definitely got a pulse still.
At Scott's Richmond practice, Badger's tumour removal surgery has now turned into an emergency.
Reagan, put your hand underneath and feel the femoral pulse.
I'm not sure if I'm feeling...
Can you just get James for us?
Yeah,
just go run into the sauce, James.
With Badger's condition rapidly deteriorating,
Can you just put your arm up there and just have a feel for a pulse?
Scott has called in vet James to assist.
You can't feel the pulse? All hands on deck. I still am in a situation where I'm sterile, trying to complete the surgery because we can't stop the anaesthetic until I've closed this massive wound. So it does mean that I am hog-tied. I can't use my hands, so I need my colleague James to come in and help with the CPR.
He's taking a breath.
That's a breath in.
Yeah.
All right, the breathing is the really important thing, so just keep on breathing for him. Don't stop.
I put him on 2 and just see how it goes.
Yep. Have you got a heartbeat? Can you hear?
I can. Oh, yeah, I have got one. It's not very strong.
Is that him then? Let's throw some adrenaline at him. Same dose.
Precious minutes are ticking by. But now, Badger is not responding.
Can you feel anything?
I can't hear anything.
No adrenaline now?
Yeah. Anything?
Badger has now been unresponsive for over 6 minutes. And Scott is forced to make an agonising decision.
Okay, I'm just gonna call it, guys. Okay, well, good work, everyone. Okay. It's one of those things.
Yeah, it's surgery, Scott.
Yeah,
You can't really.
can't leave it the way it was.
No.
I think the looks on everyone's faces, I think, says it all. Everyone's completely gutted, and especially Scott.
Okay.
Scott now has to make a heartbreaking phone call.
Oh, hi, Sarah. Hi, Scott here. Hiya. Yeah, I haven't got good news for you, I'm afraid, Sarah. Yeah, he passed away on the table, I'm afraid.
Oh, my God. Oh, what happened? Tell me.
I got probably 2/3 of the tumour out and was just sort of cleaning up the edges before closing. He stopped breathing, and this time I couldn't get him back.
Oh, Lord. I just was so sure he was going to come through the surgery.
So did I. That's why I'm like, I'm so sorry, Sarah. Yeah, she's devastated, as you would imagine. Straight away, as a parent, she's thinking about the kids and thinking about the fact that she decided not to tell them before the surgery, thinking that they would worry. And so now, obviously, they're going to be so heartbroken that they didn't get a chance to say goodbye, which is just, you know, thinking about my kids and thinking about that happening to my dog, it would be very hard. So it's a bad, bad day. Yeah. Sorry, mate.
At the Isleworth Clinic, the lost kitten is making herself at home with nurse Alicia. It's been 3 days since the little stray was brought into the clinic, and so far no owners have come forward to claim her. But she does have some unexpected visitors.
Hello.
Hi, I brought my wife in to see the kitten.
Oh, yes, I remember you found her in a bush earlier, didn't
Yes.
you? OK, perfect. What I'll do is I'll just go grab her for you and you can say hello. Thank you.
What's this?
You look like you're having fun.
We are.
I've got the gentleman who found her upstairs. He's brought his wife in to say hello.
Oh, fabulous. Come this way.
Come on, you've got visitors.
John found the little stray and hasn't been able to forget her.
Here she is.
And he's hoping his wife, Katie, will be equally smitten.
Come have a cuddle.
She's adorable.
So if nobody comes for her and you want her, we can take her out.
Hey, we want you. I think we do.
But by law, the practice has to wait 7 days to see if an owner comes forward before they can rehome the kitten. So John and Katie have another 4 days to wait.
She's adorable. She's absolutely beautiful. What we call her?
Dunno. What about Smudge?
You a Smudge?
I think she agrees.
I think she might.
So it looks like a little Smudge, as she's now called, has landed on her feet with those two, and hopefully they'll be able to take her home if the original owner doesn't come forward.
Hope we get the clip on.
In Epsom, Surrey, Scott's patient Cookie and her owner Millie are doing what they love most.
She means everything to me, really, because I've had her since she was 8 weeks old, and I've just been with her for, like, 24/7. She's always with me. She's always making me smile when I'm, like, down. She's just always there for me. She's always happy. I love her very much.
What's this?
I've never known a bond like Millie's and Cookie's. They're just together all the time. They're just peas in a pod, perfect together.
But the little Shih Tzu cross has recently developed a worrying problem.
Cookie's breathing's very noisy. When she exerts herself or she gets nervous or worried, her breathing's laboured.
It's like someone just pressing down on your chest all the time, or something just being in your throat and, like, stopping you from breathing. And I feel quite sorry for her, because, like, she can't really run around the park as much as she'd want to, because she gets out of breath quite easily.
Diane and Millie suspect there is an issue with Cookie's soft palate, but they won't know for sure till they see Scott tomorrow.
Hopefully something can be done about it to ease her breathing, especially as she gets older.
At the end of a tough day, Scott's at home in Surrey working on a special project, a chicken coop.
Yeah, I'm really looking forward to having chickens in my house. It's not something that the average Londoner can do, but now we've moved out a little bit further. I've got the space, the kids are going to love it, and these chickens just desperately need a new start in life.
Scott's getting some rescue chickens, but first he needs to finish the hen house.
Try and get your way through that, Mr. Fox. There we go.
Last year, Scott met a team of volunteers who rehomed chickens.
Hello, girls.
When the birds are no longer producing enough eggs, some of the luckier ones are given away by commercial farms and are then known as rescue hens. After careful health checks, they're then available to be rehomed.
When you think that these poor birds live their whole life in a tiny cage with wire at the bottom, they don't have natural light, it's just an awful existence for them. So I'm happy to get dirty, get stuck in, build them the coop of their dreams. Whoop, whoop. Hey, no. This really isn't a one-person job. There's a nurse when you need them. Mate, you got some screws? Oh, good boy. Good helping. That's it. Do you want to help Daddy put one in?
Yeah.
Oh, that's looking pretty good. JJ, what do you think?
Hi, Scott. Hi, Jackson.
Hey, Ali, how are you?
I'm all right. How you doing? Looking
yeah,
good.
good. Yeah, what do you think?
Scott's also been spurred on by his longtime friend and neighbour, Ali.
What do you think, Jackson?
It's looking good.
Yes.
I've known I wanted to get chickens for a long time. I mentioned that to Scott, and he said, oh, you getting chickens, I want to get chickens too. So we've decided to go and get chickens together.
Ali has already set up her chicken coop and has come over to give the Miller boys a helping hand.
I think an extra pair of hands is always useful, but a 3-year-old with a power tool is not always that helpful.
You know, as much fun as it is building with a toddler,
I can imagine.
I could do with some adult supervision.
I don't like blowing my own trumpet, but yes, I've built enough flat pack in my time to know that I can follow those instructions, unlike Scott.
I'm a bloke, I don't need instructions. Ali and I are good mates, and we forged our relationship over a long time. It's so much easier doing it with another adult. But she's also a strong-willed lady who knows her own mind. Okay.
So that has to do that.
Okay. Good.
Good.
Solid. Happy?
Feels pretty solid, yeah.
Yeah.
The proof is in the roof, I guess.
I think our little girls are going to be all snuggled up in there. Hi, baby. This is our new chicken coop.
With the chicken coop nearing completion, all that's needed are the new residents.
Why?
Getting quite exciting. It's only a few days away, so yeah, the girls are coming. Can you live with that?
Done?
Cool!
Hooray! Yes!
Go us! High five!
Oh, wow, it's so nice, isn't it?
Diane and her daughter Millie have arrived at Scott's Richmond Practice with their noisy companion, Cookie.
Hi there.
Hi.
Hi, how are you?
Fine, thank you.
Good. Is this Cookie?
Yes.
Oh, hello. She's absolutely beautiful, isn't she?
I'm hoping that Scott will be able to help her breathe and hopefully from then on, you know, she won't have a problem.
Hello, guys. How are you? Hi, I'm Scott. How are you?
Diane.
Hi, Diane.
Hello. Millie.
Hello, Millie. And who's this?
Cookie.
Hello, Cookie. You're looking very comfortable in there. That's a very funny noise. Let's hope that's just you snoring. Is it? All right. Do you want to come in the consult room? Come on.
She means the world to me, so I'm a bit nervous.
So why is she here today?
You can hear she has trouble breathing. She's got this noise at the back of her throat, which we think is a soft palate.
That is an incredible noise. So the first thing I can see is she has virtually no nostrils. Very tightly positioned nostrils like that. So that's why she probably has to open her mouth to breathe. Just have a little listen to your lungs. Well, I can still hear the noise, but it sounds far away, which means that the problem isn't emanating from the chest, it's further up, as you guessed.
Yeah.
So, I think that you are bang on in your diagnosis. I do think it's almost certain to be a soft palate issue. So basically, that's the structure that separates your nasal passages from your oral cavity in your mouth. And it's like a big, thick tongue that sort of flaps in the back. And in some dogs that have shorter noses, like little Cookie here, it's all shunted into the back. And then that flaps over her larynx, and then every single breath she takes in comes in and it goes like that over the larynx, and it's sort of flapping like a curtain in an open window. And that's the noise that we can hear. Dogs with this particular syndrome, which is called BOAS, which is brachycephalic obstructive airway syndrome, can be under real duress when it comes to exercise or when it's hot and they're running out and about, say, in the park, and they can literally suffocate. So what we need to do is to perform surgery ASAP. Cookie could really be in a lot of danger, so we do need to address this problem now. Your little princess is going to need 2 little bits of surgery today, all right? First off, we need to make her nostrils bigger, and then we need to shorten that curtain, all right? It's flapping over her airways, all right?
It's really scary because she hasn't really been under anaesthetic that much, and you don't really know.
You okay? You're a bit worried, aren't you? All the animals that come into the practice are loved, but you can really tell there's a very close bond between Cookie and Millie, so I'm definitely not going to let her down today.
Thank you.
All right. Say goodbye.
I'll see you later.
Say bye. And hopefully, when you see her again, she'll be making less noise. Say bye. Say bye.
She's very special. It's sort of unimaginable, isn't it, to be without her? So, yeah, it is worrying.
Hey, you sound like me when I'm asleep. Hmm?
In Isleworth, it's now been 7 days since John found the lost kitten.
Go on then. In you go.
And he's back today with wife Katie and daughter Parker.
Hello.
Hi.
I do believe she's yours. Finally. Do you want me to go get her for you?
Yes, please.
You excited?
Very.
I'll go get her.
I'm very, 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 very excited.
How are you? It's been 7 days and no one's come forward to claim her, so it looks like Smudge is definitely Katie and John's. They look so excited. Here she is.
Hello.
And I think little Parker could hardly contain herself.
Look, it's your new kitty.
Finally. Finally we get to take her home. Been worried all week that someone was going to come in and ring and say that she wasn't ours, but now she is.
Very exciting.
She's so cute. I'm going to kiss her.
And kiss her nose.
Yeah.
I think Parker and Smudge are going to get on very well. I think we're going to have friends for life.
She's very, very excited to get this cat home and give it lots of cuddles and play with it and introduce it to the dog and the cat. Are you happy now?
Yeah.
It's great to know she's going to a loving home.
Should be a welcome addition.
Bless her.
Wow.
It's going to be a shame for us not having Smudge here. She's kind of settled in brilliantly over the last 7 days, and it's going to be odd coming to work and not seeing her. But having her in a family environment is what's best for her, and it just wouldn't be fair to keep her here just for us.
Say bye to Lily.
Bye-bye.
Thank you. Bye.
Bye.
Should we take her home then?
I don't want to use her.
Come on, Em.
That's right, sweetheart. Good girl. Okay, thumb more. So nearly done, sweetheart. Good girl.
In Richmond, Scott is hoping surgery will help give Cookie a better quality of life. Nurse Nathan will be assisting.
Hey? Yes.
Cookie has small nostrils, as well as an elongated soft palate that is obstructing her airway and causing her constant snorting.
Brachycephalic obstructive airway syndrome is the problem, and the solution is not only increasing the size of her nostrils, but also reducing the size of her soft palate, which will reduce the noise and hopefully make Cookie breathe easier.
Hey.
Hey. Hi. How's it going?
Going good. How are you doing?
To perform the surgery, Scott will also need the help of new vet Phoebe.
What I'm going to do, Phoebe, is just going to place some stay sutures that you're going to hold behind my head so we can both see what we're doing. With that hand, if you hold on there, there we go. OK, good.
As well as a new vet, Scott's also using a new piece of technology for today's surgery.
So what benefit does this new bit of kit give you?
Well, it's incredible, really, in that it cuts using radio waves, high-frequency radio waves. Today, I'm very excited about our new toy, which is radio surgery. It basically uses high-frequency radio waves to cut through tissue. It also clots the blood as you cut it, and then you're able to remove the tissue altogether. So it's a very clever bit of technology, and it basically flies through a probe that I hold in my hand, just like I would a scalpel. So it's quite a meaty one for a little dog.
Mm.
Here we go. Yeah, well, I mean, I think my kit worked really well, although the smell...
It's not great, is it?
It's not barbecue fare, is it? But that's actually cut that beautifully. Can you see that?
Mm.
Good.
It's not bleeding at all.
You're right back there, Phoebe.
Yeah, I'm all right. Just leaning on you for support, as usual, whilst also being a massive weight on your shoulders.
OK, so let's let those stay sutures go now, Phoebe, and see. That's it. Good. Look at that.
Right.
Staying there. Beautiful. After trimming the soft palate, both Phoebe and I can see very clearly down the back of the throat that that soft palate is no longer going to be the cause of that reverberation, that noise, which is great.
It's really good.
Yeah, pretty happy with that.
Life-changing.
Hopefully it will be, yeah. All right, let's move on to the nose then, shall we? The next procedure I need to perform is basically a nose job on Cookie to increase the size of her nostrils, and that's called an alarplasty. So what I do is take a little wedge of tissue from each of the nostrils and then flare them open, increasing the nostrils, increasing the amount of air that she can breathe, and reducing the noise she makes. Okay, it's amazing. And the lack of bleeding is really quite awesome. Okay, so let's suture that one. Look at that instant nostril. Yeah, okay.
Oh, that's so much better.
All right, let's wake her up and see if she has stopped making that awful noise. Hey, what did I say? That's the moment of truth. All right, sweetheart, good girl. There we go. There we go. Oh, hello. Listen to that. Happy with that. Eh? Yeah. Looks good, sounds good. Yeah. The proof really will be in the pudding when it comes to Cookie recovering from her anaesthetic, because the tube's been down her throat, so we know there's a bit of throat clearing, there's maybe a little bit of fluid in her nose as well, and a bit of irritation to her windpipe because of the tube. All of that adds up to being far less than the noise she made before we started, so it's a great result.
Once Cookie fully recovers from the anaesthetic, Diane and Millie will be back to collect her later this afternoon.
Hello, baby. Hello. Hello, sweetheart. Hello. Listen to you, eh? Oh, what a lovely, quiet girl you are.
In Richmond, little Cookie has recovered from her soft palate surgery
Come on, then.
and has been given the all clear to go home.
That's it. Look, there's your bag. In you go. Good girl. That means home, doesn't it? Good girl.
Scott used a special new cutting tool for Cookie's surgery, and vet Phoebe has wasted no time getting in some practice.
Hello. What are you up to?
Just practicing.
Wow, what's your patient's name?
Porky.
Porky. Wow, you're doing a very nice job on Porky.
Well, you've got to start somewhere, haven't
You
you?
do. Practice makes perfect.
Practice makes perfect.
She'll be pleased to see you. Won't
I
she?
can't wait.
I know. Are you worried today?
Yeah.
No, so was I.
The day went by so slow.
I know.
Upstairs, Cookie's owners Diane and Millie are eager to collect their little girl.
It was a pretty horrid day. I had to sort of, you know, keep myself occupied and Yeah, try not to worry and be positive. And I'm a bit apprehensive to see her and find out how she's coped with it and, you know, just see how she looks and how she's acting.
Hello.
Hello.
Here she
Oh,
is.
hello, baby. Oh, look, you've got purple stitches.
She's got new-looking nostrils.
Are you all right?
Let's just have a listen. What do we hear?
Silence.
The sound of silence. Massive difference, eh? So the first thing that we did is had a look in the back of her throat, and just as I suspected, that curtain was right in front of the open window and just sort of being sucked back, and that sort of vibration was making all that noise that we could hear. So that got trimmed. Then the second thing, as of course you can see, she's got slightly different shaped nostrils now. By just giving that increased aperture, you can see that she is just making far less noise.
That's great, isn't it?
Yeah. You're happy to have her back?
Yeah, we couldn't wait, could we? Couldn't wait to get her back. The recovery is incredible. You can't hear her heavy breathing anymore. She's come through it okay. Yeah, she looks great. Just a bit of TLC now and she'll be fine.
It's going to be really quiet. I won't have to put headphones in to block out her snoring anymore.
All right, then. Bye-bye, beautiful. What a sweetheart you are. Back to Mummy. Here you go.
Thank you.
You're very welcome. Handing Cookie back to Millie was a wonderful moment because you could really see that she was just so happy to have her little companion back. And for me as a vet, it's really rewarding because I know I've done my job to ensure that Cookie is going to breathe beautifully and healthily a long way into the future.
Bye.
Here we go.
Let's go get the girls.
It's the weekend, and Scott and his neighbour Ali are picking up their rescue hens.
Hi there, you must be Fran.
Hi,
How
I'm
you doing?
Fran. Nice to meet you,
I'm Scott. Yeah, and this is Ali.
Hi, nice to meet you. How you doing? Ready for your girls?
We're very excited.
We're not, we're excited.
Do you want to follow me? I'll lead you the way.
Excellent.
This is one of the collection points for the British Hen Welfare Trust, where the public can come to get hens for rehoming after the birds are no longer productive enough at commercial farms.
Oh, bless you. Hello.
Hello.
Okay, should we start grabbing them out? Yeah?
But first, all the birds have to have health checks.
There will be 150 chickens here, sort of all needing to have a once-over, have their claws clipped, etc. So it'll be great that Scott and Ali can help us do that.
Come on, sweetheart.
Good girl.
Go that
10.
way. There we go. Good girls.
You all right?
Off you go, girls. Come here, sweetie. There we go. All right. Okay. All right. Okay, baby girl. Birds that have been in a caged hen environment have feather loss. They've also got very floppy combs. And some of them are quite lean, which maybe means that they were just a little bit more picked on than some of the others. So they were at the end of the food queue. Right, let's have a little look at you. So, first thing I noticed there, she's got this very pale comb, flopping down like that.
That's really common, yeah, but that will shrink and it will go bright red once she's sort of cooled down a bit.
Yeah.
Just because it's so hot in the
bit
cages.
of sunlight. And
Exactly,
good
yeah.
diet.
It'll do her good, yeah,
Yeah.
definitely. She'll be right as rain.
Okay, let's have a little look at this girl here. Whoa, okay, okay. Let's have a look at your nails. So, yeah, they're quite long,
Very
aren't they?
pale legs. These birds shoved into spaces that are too small with no natural light.
There you go, sweetheart.
Their feet are on wire their entire lives. They're dumped at 72 weeks because they're not laying as much as they need to lay. You know, they're just effectively a living machine. That doesn't sit comfortably with me.
Ali, do you love this one? I think this one's your first chicken.
Bless her.
Okay. Ali's definitely got her eye on this one. It's because Ali's had her first chicken cuddle and she's smitten.
No, sweetheart. I just want to give him a good home, really.
Okay, so she can go down. Once we've examined all the birds and they all seem to be in pretty good nick, Ali and I get to choose chickens, which is very exciting indeed.
Lovely. Well
It's like my Rocky moment. I've got you, I've got you. You're definitely coming home with me after that.
This one's very talkative. I think she'll suit my household very well. Oh, good girl. It's three. Three more.
So these girls don't really know how lucky they are. As soon as they get home, they'll be sunbathing for the first time, standing on grass for the first time, laying their first freedom egg, which is amazing. So they've got just a whole free-range retirement ahead of them, and they're going to be really, really happy.
Hello. You home?
Scott is dropping off Ali and her hens first.
I'm hoping they'll settle in pretty quickly.
Yeah?
Sweetie.
Say hi to Mummy.
Hello, me. I want them to have a very different life. I want them to have fresh air and sunlight and freedom and the best food you can give them, all the stuff they're going to love. Welcome to your new home.
Some more females enter the ranks of the Miller household. You come to welcome the girls. Come on, then.
And now, Scott can introduce his new arrivals to their brand new home.
Come on.
I'm really chuffed at the whole process, actually, and to finally have the girls here and to know that they're safe and happy and well. It's such a wonderful feeling.
Look, sunshine and a tree. And now those furry things down there are dogs. And you're going to meet a few more people soon. Hey? Come on, then. In you go. You guys have a nice little rest. A few more important people for you to meet. Yeah? Look. Who do you think's going to be in here, JJ? Look. Yes. Do you want to meet them? Look.
The new arrivals are settling in well, and Scott is excited to introduce them to the family.
They are very cute, aren't they, mate? Very cute. I've already called that one. That one's Eggy, that one there.
Eggy?
That's Eggy there.
Okay.
Yep.
Did
And
you
then
see
the dark
that,
one
Anna?
there, that's Chuck Norris there.
Daddy, look!
Oh, wow, one's gone out. Yay, that's Hey Hey.
It's always special to rescue animals, but to know that they wouldn't have been alive if it wasn't for us taking them to our new homes is just such a wonderful feeling.
That's Pasta. Hi, Pasta boy. It's a girl. Hi, Pasta girl.
Yeah. They need to be girls to lay eggs.
If they were boys, they'd wake you up at 5 o'clock in the morning.
That's true.
Like you do.
Just introduced the chickens to the kids and they think they're wonderful and they're so excited for them to be here. It's just such a lovely additive to the family and also the end of the journey to have the girls here and to have them comfortable and happy and they're already eating and pecking around. It's a really good result, so I'm ecstatic.
And 3 weeks later, Scott is checking up on little Cookie.
Hello. How's it going?
Fine, how are you?
Good. Hello, beautiful. I've been looking forward to seeing you.
Come on in.
Thank you very much.
The Shih Tzu Cross had nose and soft palate surgery to fix her constant snoring and breathing difficulties.
Well, first things first, let me see this beautiful face. And she has nostrils. Look at those. Big difference,
Yes,
eh?
huge difference. I'd say she's about 80 or 90% quieter.
Wow. Straight away, you can hear that she sounds better, she's far quieter, which means that Millie gets a good night's sleep.
Less noise, more energy. Huge difference, yeah.
Gosh, that is incredible, isn't it?
She's a different dog. She just enjoys her walks so much more. And she sniffs. She stops and sniffs, which she never did before, really.
Really?
Yeah.
She's
I
found a
mean,
sense of smell.
Yeah, it's really different.
Which is just awesome. It's the
Yeah.
icing on the cake, isn't it? Hello, Oliver. How are you? The happiest Yorkshire Terrier that ever lived, aren't you? Aren't you?
He has no idea what today's gonna bring.
Yeah, so
Neither
it's
do
crunch time today, hey?
Yeah, bit nervous, but
Yeah, understandably. I've been treating Oliver for quite a while and he has a condition known as medially dislocating patella, which is basically where the kneecap pops from the groove that it should be sitting in inwardly. Pop him on the ground and we'll just sort of see how he is walking at the moment.
there's the hop.
Yikes. Yeah, I mean, that's not even limping. He's just fully lifting his leg off the ground, isn't he?
Yeah, and it's
Wow.
definitely gotten worse, so.
Yeah, that's not a dog that's a little bit uncomfortable. That's a dog that's quite significantly uncomfortable.
Yeah.
Watching Oliver walk, it's clear that the knee has deteriorated. He's barely putting his leg down. So we are going to have to bite the bullet and get this dog's knees sorted. And no matter how many licks, my friend, I don't think you're going to get out of it with charm. Eh? Come on, guys, let's go.
Oliver is my little baby, and I'm quite nervous for today. So if surgery is the option, I'm going to be a bit upset about it just because it's quite a lot and he is a small dog. But I just have to think of what is going to be best for him and getting him back to being healthy and happy and the dog that we love.
All right, I'm just getting you just to hold him around the shoulders there. Okay. All right. So his left one is the one that's really causing him some mischief at the moment.
Yeah.
So what I can feel is that his kneecap is literally out of the socket, and it's permanently out now, which is why this leg is becoming more and more dysfunctional.
Yeah. Is it painful sitting outside of it?
Well, I think a lot of the pain is already endured because it would have had to stretch significantly so that the ligaments allow it to pop out and stay out. But now it's staying out. He's just sort of trying to use what is a pretty dysfunctional leg.
Yeah.
The unfortunate thing is that his right knee really isn't that much better. If you put your finger, see between my thumb and my index finger, and I can just show you how easily this knee, so it goes.
Oh, yeah, yeah.
And that takes
That can't be good.
virtually nothing for me to do that. But it's the best of a bad situation. So what he's doing is like, this one is horrific, this one is terrible, so I'll stand on the terrible one.
Yeah.
But he is masking what is significant and consistent pain. You know,
Yeah.
enough's enough, and we need to, we need to do surgery.
With Matt and Megan expecting their first child in just a few months, Scott thinks it's best to operate on both knees at once.
So we have a couple of things to take into account, and that's absolutely right and fair. Life is never simple. And because he is so small and so light, and he is so friendly and he's going to be a great patient, I think it makes sense that rather than going through stage surgeries, what I think we should do is to fix your fur baby in one foul swoop, get to the other side, and then we can enjoy next baby.
Right, exactly. Well, no, it's obviously daunting to hear that, but of course we want him to be back to his normal self and, of course, before the baby arrives. So if that's what needs to be done, then we'll just have to let him...
Yeah, he's a tough soldier.
Yeah, he's been a trooper, as you can tell, so I know he can do it. It's just, he's just so little. I'm really nervous, actually, about it. I mean, I know he's in great hands, but he's just so small, and he's my little baby, so I'm just nervous for him. I know he can do it. He's been a trooper, but yeah, it's a lot.
We'll be sitting by the phone, waiting for Scott to call, for sure.
He's fine.
See you later, mate.
I'll look after your little man. Don't worry.
Thank you, bye.
All right. Bye, guys. See ya. It's okay. I'll sort you out. Don't you worry.
Clever puppy. Good boy. Yeah.
At an Isleworth park, playtime is not as carefree as it once was for Labrador Jessie, his owner Angela, and her daughter Emma.
Jesse's 9 now. Slowed down a lot, hasn't he? He's not quite as boisterous. He's still, quite jolly when we take him out. He still likes to run after his ball, but not quite so enthusiastically.
Yeah, he's a good boy. Good boy. Good boy. Good boy.
In the last few years, the aging Labrador has started developing worrying lumps all over his body that are inhibiting his movement.
Well, there's a few lumps he's got. There's one very big one here, one just here, but the one we're really worried about is right in his armpit, so you can't actually see it, but I can feel it, and it's really big, like the size of a tennis ball, and it's really hard. So that's the one we're hoping Scott can investigate and do something about.
He's had 3 or 4 removed over the years, but this one, the biggest one, is the greatest concern now.
I found the lump probably about 6 months ago. Gradually it's got bigger, and it's quite hard as well, whereas the others that we've found in the past tend to be a bit more malleable. So this one is a little bit different, which would indicate something much more serious.
Jessie, can have you dirty? Thank you. Jesse is absolutely everything to me. He really is. He's integral to the family. I don't know what we'd do without him, really. He is my baby.
Tomorrow, Angela and Emma will be taking Jessie in to see Scott to determine what can be done about the lumps and whether they are dangerous.
Jessie, you've got a very busy day tomorrow, haven't you?
Right, little man. So to avoid you feeling intimidated, I've assembled my smallest staff members. For the first time ever, you feel like a Great Dane, don't you, against them? Yeah? Because I feel massive.
At the Richmond Practice, 8-year-old Yorkshire Terrier Oliver is about to undergo major surgery on both of his knees.
So let's pop him down. So he has very clear dislocating kneecaps, patellas on both sides. The left side, the one you're feeling now, you can probably feel the knee is just living out of the joint.
Yeah, it's here
out of that
on the
groove.
side, and it's really difficult to even push it back in.
Scott will be assisted by graduate vet Phoebe and nurses Sam and Jess.
Hey, it's time for sleepy bye-byes now, mate. All right, sweetheart. Good. We'll give you some new knees, shall we? Yeah? Sound good? Although Oliver is a very small patient, it's quite a large procedure that we're putting him through because we are actually going to be performing a knee operation on both of his legs. Now, normally, we probably wouldn't do that, but he's such a strong little dog and he's so very light that I feel that the best way to get through this is by doing them both at the same time, just one recovery period, and this boy should do well. How's he faring, Jess? All good?
He's doing really well, yeah, I'm happy.
Okay, all right, well, I'm going to start cutting now, okay? So what I'm looking at here is what's called the trochlear groove, basically where the kneecap slides up and down the leg as you bend and extend it. So the first thing that strikes me when I'm looking at that is just that should be a groove like that, and it's flat. So there's no way that anything is going to sit in there. This is virtually non-existent. So what we need to do is just deepen that groove, just to give it at least the chance of staying where it's supposed to be. And then just adding insult to injury, I can see that his cruciate ligament is partially torn, and that's given even more instability to the knee, which is probably why he's gone from a dog that was coping to a dog that's not. So a little bit more surgery for us to do today than just a, I'll say, simple knee op.
Oliver's marathon surgery is going to take even longer than expected.
I think this sort of surgery really challenges you as a surgeon because it is one with a lot of potential complications, and you are, at the end of the day, cutting bone. You have to be very, very delicate because little Oliver is very, very delicate. Basically, I'm remodeling the groove that the knee sits in, and that just means deepening it to get a functional result, which is Oliver's knee sitting where it should be, not popping out and not causing lameness. So I'll just protect that. There we go. Okay, so there's our wedge. Okay, we're just going to deepen that, and then that little wedge will go back in. So this little wedge I'm about to put back into that deepened groove, hopefully will fit in very nicely, and it'll stay in place because, first of all, bone wants to stick to each other and heal. But the second thing is that you have got a kneecap which will be sitting on top of it, and it'll be putting downward pressure on the area. So then it will stick back where it should, but the knee also has somewhere to live.
Oh, wow, yeah, definitely.
Yeah.
Yeah, it's a nice groove now.
Scott now has to perform the trickiest part of the surgery, moving the kneecap back into alignment.
So you can see it's only a few millimeters, but it'll make all the difference to a little dog. So what I'm going to do is, once I've got it into the position I want it to be in, you're going to hit the end. Okay. Okay, you all right?
Yep.
Yeah, you look a bit nervous. You okay? I know it feels very unnatural to be smashing a hammer into a small Yorkshire Terrier. But
I know.
you just need to try and be confident, be brave. Okay, nice firm hits. Okay.
It's Phoebe's first time doing this kind of surgery, and one wrong hit on Oliver's fine bones could be disastrous.
Go for it. Yep.
Okay.
So we're getting closer now. So if you just sort of do one hit at a time.
At Scott's Richmond Practice, the team are halfway through Yorkshire Terrier Oliver's marathon operation. to fix 2 dislocated knees and a cruciate ligament tear.
But that should hopefully keep that kneecap in much better alignment. With the left knee now nicely in alignment, I do need to correct his ruptured cruciate ligament. Just take your time, okay? It's not a race, so don't go, because that's more likely to break it. Just slowly increase the pressure, all right? Okay, so slowly increase the pressure. Got it to the full force you can get it? Yeah. Basically what this stitch will do is to mimic the tension placed on the knee by the cruciate ligament and stabilize the joint. Okay, so if you release, that shouldn't release. Yeah? Happy?
Happy.
2. Ta-da! There we go. Okay, right, so that's left leg done. Now, everyone got the energy to do the right leg?
Which will hopefully be a bit more straightforward.
Yes, should be. So when we saw Oliver walk, his right leg was much more stable, and it did seem to be a much straighter limb. So all I need to do with that one is just deepen the groove that the knee sits in, and hopefully it'll make a full recovery.
It's a challenging surgery.
Very.
An interesting one to watch.
Yeah. I think with every surgery, you just need to be prepared that there might be curveballs.
Yeah.
Two surgically corrected legs. Oliver's obviously been through a massive procedure on both of his legs, so he will be in a little bit of discomfort, so he needs lots of medication and TLC overnight. Hello, mate. Hello, buddy. Oh, sweetie. Here we go.
Boy, been very brave.
Some nice happy drugs on board. That's why he's taking his time. Yeah. He's going to feel so much better after this is done. Hey, this is day 1 of the rest of your life. Just quite painful day 1, isn't it? Yeah. I'm not going to sugarcoat it. Oliver's recovery, his rehab will be long and at points painful and uncomfortable. But I know that Megan and Matt are in it for the long term, incredibly dedicated owners, and they're going to will him to a full and complete recovery. Here we go. Oh, brave boy. Here you go. Hey. Heart of a lion, haven't you? Very brave.
Next day, Angela and her daughter Emma are arriving at the Isleworth practice with their much-loved family dog, 9-year-old Jessie.
Morning, ladies.
Hello, Scott.
Hello, Jesse. How are you, handsome boy? Are you okay? Well, he's still wagging his tail, and that's a standard with this boy, isn't it? Hello, mate. You all right?
The mother and daughter are worried about a number of lumps growing on the old Labrador's body.
Come on then, lad. In you come. Come on.
Here we go.
Come on, buddy.
Jesse's his usual cheerful self, but he's obviously very suspicious about what's going on. And of course, we're here to reassure him, so he'll be okay, I'm sure.
And he seems to really like Scott, which really helps.
Yes, he is a lovely boy. All right.
He's a lovely boy.
He'd be the kind of dog, I reckon, that if he could sit on your lap, he would, you know.
Oh, yes, he has tried.
So the main issue, though, he's in for today is, of course, the lumps that he's been developing over the years. And there's this one big one, isn't there? Yeah, it does really feel like it's got maybe even a bit harder in the last couple of weeks. The last time I felt it, it was just a bit softer than that.
Yes, very worrying, really.
Yeah, and it's also, it's in a really awkward place for him. And he's already an older boy.
Yeah.
We've already seen that he is suffering a little bit with arthritis. He's a bit lame from time to time, isn't he?
Yeah.
So we can't have that. So that's the main thrust of today is to try and take that away and alleviate some of the discomfort that he's feeling.
Good.
But let me have a feel of some of the rest of them just to see, because he's got a little one there and then another little one here. One that I'm a little bit concerned about is actually this one here.
Really?
The reason that I'm concerned about it is it's in a position known as the popliteal lymph node, and it's just quite swollen, that one. So unlike these ones, which seems to be just underneath the skin, this is actually attached.
Right.
Right, yeah.
Examining Jessie, I'm quite concerned for a number of reasons. First of all, He's an old dog, and he does also have kidney disease, but beyond that, he's smothered in lumps. He's got soft lumps all over his body. And the ones that Angela and Emma are concerned about are the big ones near the front, but I'm actually concerned about the small little lump at the back. I feel like today it's an opportunity for us to kind of improve his quality of life. But to do that, we need to accept a few risks. And obviously he is an anaesthetic risk because he's an older boy, but he is tough and he is a fighter and he's been through a lot already, and yet he comes through every time. So all we can do is really hope that that's exactly what's going to happen today.
Yes. Oh, you poor old thing, Jessie. I'm just worried now. This new lump has come as a surprise to us and is really of more concern because it could be a different type. And obviously that raises other issues. It could be something more sinister.
Nice and slowly. Good boy.
Having heard what Scott said, I'm looking forward to finding out what it is.
Me too, yeah. Just be nice to know now and get everything sorted out.
Oh, Labrador.
And this is Jessie. I thought you quite liked him, Sam.
I love a Labrador.
Assisting Scott with the surgery are nurses Gina and Sam.
Today, we're just going to try and remove the lumps that are most concerning, understand a few of his problems, and get him back on track.
All right then, buddy. Sleepy time now.
There's always risks with any anaesthetic, but Jessie particularly has not been the healthiest of Labradors. So when it comes to the anaesthetic, we need to watch him like a hawk.
Moments later,
come on.
Scott is suddenly alarmed.
When your patient fails to breathe or react in the normal way, nerves start to rise. Just gonna flip him onto his other side. You're just trying to manage your own panic. Come on. We need to make smart decisions and we need to save our patients. Come on, mate. We've got a pulse ox somewhere, haven't we? Because he's not breathing.
In Isleworth, Scott is fighting to save elderly Labrador Jessie after he stopped breathing just moments after being anaesthetised.
Just give him a breath of air. Come on. This is an old boy, and the longer this process goes on, the more concerned that he simply will not survive this anaesthetic. Come on. There we go, that was him. Okay, you took your time there, pal. That wasn't good. Thankfully, he starts to breathe. Phew. Now that Jessie is comfortably under anaesthetic and breathing well, I'm able to examine the masses a little better. And the one right under his armpit really is quite incredible. It's quite hard. It feels like about the size of a grapefruit, and it must be incredibly uncomfortable for this poor old boy.
Oh, well done, Scott.
Jeebus. Jessie's going okay. He's not giving us the easiest run when it comes to the anaesthetic. That's probably why I'm scrubbing just a little bit harder than I normally do. Stay alive. Yeah.
Scott's first job is to remove a massive lump from high up in Jessie's foreleg.
So I'm going to take out the big one first and then just check and see what the lymph node under there is looking like, and then I'll move to the back. All right, guys, so I'm just about to cut. So it looks like it's just a big, massive, fat lump, really solid. It's fatty tissue, which is good, so it means it's nothing nasty, hopefully. We'll send it off to the lab to make sure, but my guess is that this is going to be just fine. Certain breeds of dogs are more prone to lipomas, but also older dogs and dogs that are carrying a little bit of extra weight. If you're putting on fat all over your body, you're more likely to get larger lipomas growing. It's just where it's grown. It's actually grown between some muscles going right into the armpit, so it would just be super uncomfortable. So it is definitely coming out. Only just very flimsily attached. So that's just coming away. So now we're out of the way, I think Jessie's going to be so much more comfortable.
That's gross.
Initially, my plan with Jessie was to remove the very large grapefruit-sized lump underneath his left forelimb, but there's another lump of a decent size right beside that lump. So I thought to remove all the lumps that I can on the left side, including the one near his left hind limb, but I'll leave the rest alone because it'll take too long and the anaesthetic will become more risky.
He's been under for 2 hours now.
2 hours, okay. Yep, I'll be quick. Right, so there we go. So that one's done, that looks quite nice, and actually it looks much nicer than it did half an hour or an hour ago. So what we're going to do now is just go to the back end and just take a sample out of that. This is a really hard one to navigate because when you have a hard lump in an old dog, it doesn't take much to think, you know what, that might be cancer. So I'm most concerned about this lump because of where it is. It's actually right in the position of a lymph gland called the popliteal lymph node. And so when a lymph node's swollen, it can sometimes suggest, worst case scenario, cancer. So that's why something so small compared to something so big, yes, that was bothersome, but that bothers me. Okay, so I'm just going to incise over it now. See what it's doing there?
Yeah. It's just breaking.
Yeah.
Like fat.
Yeah.
As it is fat.
That's good, isn't it? So it's actually attached to the gland beneath, but it seems like it is superficial. And the gland's actually underneath. I can feel it with my finger. Very clearly, it shows me that actually this is a lipoma that's decided to stick itself to the top of a gland, but actually the gland underneath is perfectly healthy, so it's a really great result for Jessie. We'll send it off to be 100% sure, but if I cut through that, it looks just like white, glistening fat. It's a good way to end a 2.5 hour long surgery, isn't it?
Yeah.
It's a massive relief for me as a vet to see that this is a little bit of fatty tissue over the top of a very healthy gland. And that's that. So let's work this boy up. But it would have been really difficult to work that out until you actually open up and take a look. You would have been sampling what you thought was fat, never getting the glandular tissue, questioning why these results were never giving you the answer you needed. What you needed to do is to go in and just remove a little bit of fat, and that's exactly what I've done. Oh. There we go.
Jessie will sleep off the anaesthetic before going home tomorrow.
Right, you have a snooze and I'll call Mummy.
Hello, you all right?
After an overnight stay at the Richmond Practice, Scott's patient Oliver is ready to go home.
Should we go and see Mummy and Daddy? Yes? Yes? Come on then.
Oh, come on, big boy. Come on. Come on. Let's show them how brave you've been. Good boy. That's it.
Upstairs, his owners Matt and Megan can't wait to be reunited with their little man.
It's been tough, but both getting through it together. I know he's a warrior, so I'm excited to see him. I know he's been tough through this, and I think he'll be happy to see us, and vice versa.
Here's your little soldier. So he's been an incredibly brave boy, but obviously he's still a bit uncomfortable, aren't you, mate? So he's not at his scintillating best. Bit of a surprise on that left leg. He did pretty much completely tear his cruciate ligament, which is a big ligament in your knee. Yeah. So that was probably the reason why he was even more lame than he'd been in the past.
Okay. Sure.
So it means that I could fix that alongside all the various other issues that were going on in that knee. And then the right leg, of course, has also been corrected.
Amazing.
But he's been such a trooper in that we put dressings on initially. He wasn't that comfortable because he's got two big, thick red legs. But once we took the right one off to see how it was looking, actually, he's now already standing on that leg, which is incredible.
Wow.
Really good. It's a long road to recovery. You know, he's been through a lot.
Yeah.
So it's going to be a good kind of maybe even 10 weeks before he's really going to be walking perfectly well. And during that time, lots of physiotherapy and lots of TLC, which I can see he's going to get.
Yeah. Just happy to see him, but just can't believe how much pain he has been suffering in, and knowing
About the haircut as well, isn't it?
Yeah.
Well, yeah. Apologies for that in advance. I'm not a barber. I've done my best.
It's so amazing to finally get to hold my little baby and see that he's okay, although obviously he's a bit distraught from yesterday, but we're so glad to have him back.
You've got a bit of work ahead of you, haven't you, mates? Hey?
Yeah.
So have you two. It's called a baby.
Yeah, I know. We've got a lot on our plate at the moment.
You do.
He does as well, so
Yeah.
we know he can do it.
Yeah.
So I'm hoping the 10 weeks will be in enough time for when the baby arrives, and of course he can be back on his feet and able to help us out and support her. But overall, we're just ecstatic that he's in our arms now. Nels, thank you so much for looking after our little boy and taking such good care of him.
Oh, you're very welcome.
Good in the long run.
That's it. In the short term, it's not much running, but in the long run, hopefully he will run.
Yeah, exactly.
Yeah.
Aw.
Next day at the Isleworth practice, Laura is bringing in 3 unusual patients to see Scott.
Hi there. Hiya, I'm here with my ferrets today for their vasectomy.
Oh, they're so sweet. Oh, look at them.
They are very cute.
Scott should be around here soon, so feel free to take a seat.
Thank you very much.
No problem.
I've got 6 ferrets. I've got 3 boys and 3 girls. Boy ferrets have to have a vasectomy, unfortunately, so that we don't end up with baby ferrets from our females at home.
How are you, Laura?
I'm okay, thank you.
Nice to meet you. What are their names?
Harry, Ron and Neville.
Hello, boys. It's Ron, Neville, and Harry. I pick up on a little bit of a Harry Potter vibe there. You come in to get the unkindest snip of all.
Yes, they are.
Hey. All right, then. Well, let's go into the concert room and have a chat about that. Hey, chaps? Pink box. Unbelievable. Eh? Now, it sounds like a whole bunch of male ferrets have sat down together and made this fact up, but I promise it is fact that if female ferrets don't have sex, they can die. And the reason is that the female will continue to cycle until she's mated, producing a huge amount of estrogen. And that high level of that hormone can depress her bone marrow, lead to anemia, and eventually she can die. So who's this?
This is Neville.
Hello, Neville. How are you, you smelly creature? So the plan today is to vasectomise the males, and so they can continue to mate with the females stop cycling, and the males literally save the females' lives. But the one thing also you need to remember is that 6 weeks after we've done the surgery is the first time they can really be properly introduced to the females, because there can still be a little bit of cheeky sperm lurking around, ready to, yes, impregnate the young ladies.
Yes.
Hey, mate. All right, then. Let's have a proper look at you and make sure that you're all A-OK. So, something that I'm always wary of with a ferret, they're rather large teeth.
They are rather large.
Yeah, for a small animal, I mean, that's gigantic. And they're also quite strong-willed, so generally if they don't like what the vet's doing, they will...
Yes.
Let me have a little listen, and here we go, sweetheart. Very pretty, aren't you? Okay, good. And then if I can just have a look at the, shall we call it, problem area? Just see what we're dealing with here. So 2 testicles down here. And then his little willy is just there. So we'll be doing incisions sort of here and here.
Okay.
All right, mate. All looking very good. Should we have a look at your brothers then?
Yes. This is his brother.
Hello. Hello, brother. What's his name?
Ron.
Hello, Ron. Hello, mate. Hello. No biting. Hello, Ron. Hello, mate. Hello. I haven't done a vasectomy on a ferret before, so I'm quite looking forward to it. But they are really quite quirky little animals. Yes, they smell a bit. They're a bit pongy, but they're really cute once you get to know them. There we go.
Small in size, but big in personality, this one.
Right, okay.
It's Harry. Harry's a monkey.
Very pretty, aren't you? Apparently very naughty. Yes. They're all very healthy ferrets, large teeth as you would expect, but everything else is in perfect working order. All right then, Laura, well, you can head off.
Thank you very much.
I'll look after your boys.
Thank you.
And we'll see you a little bit later.
Thank you very much.
All right, take care.
Thank
Don't worry,
you.
I've got them.
I'll try. Thank you.
Bye.
Bye. I feel a bit guilty about making them have the cruelest snip of all, but I know they'll be in safe hands with Scott. I just hope they don't take it out on me when I get them home. Hopefully they take it out on Scott today.
Just remember, she's doing it to you, not me. Hello, you're going to be good. And if you've never worked with ferrets before, Lily, big teeth. So be nice. Hey.
At his Isleworth clinic, Scott is about to perform vasectomies on 3 ferrets, assisted by Lily and Jess.
Some Harry Potter-inspired names here. We've got Harry, we've got Ron, and we've got Neville.
No Dumbledore?
No Dumbledore, no, unfortunately. No, or Snape.
Why?
But
No. They're quite sweet.
they are, aren't they?
Hello.
All right, so if you guys get ready to catch, yeah? See, it looks like Neville's coming out first. Go on then. Good boy, well done, Lily. Here we go. I think today what we'll be doing is gassing them down with a little bit of inhalation anaesthetic. Then we'll be acting like a little bit of a factory line. So Lily, I'll be getting you to do the anaesthetic and then doing the clipping. And then Jess and I will be in the surgery. And so we'll be performing the vasectomies. Once they're recovering, we'll swap and we'll just keep working through the brothers until they're done.
Sounds like a plan.
Yeah? He's like, that sounds horrible. That sounds awful. Eh? But hey, at least you still get to have some fun with the girls. It's okay, so lucky. Hey? All right, you ready?
Yep.
3, 2, 1, in. So the plan today is to vasectomize the males because then they can continue to mate with the females, but they won't have any babies. So there we go, Jess. So there's the spermatic cord. So that contains the blood vessel and also the vas deferens, which is that tube that allows the transport of sperm from the testicles that produce them to the penis where they go out.
So I've had experience with ferrets in the past, but not a ferret vasectomy. So yeah, it's all quite new to me.
What I've done is just cut through the little sac, which is called a tunica vaginalis, around the cord and separated it into its 2 parts, which is the vas deferens, which is this white tube here, and then obviously a blood supply. So we're going to leave the blood supply and we're going to cut this tube that carries sperm from the testicles to the outside. And that should stop this particular ferret from ever being able to father any young. So that's number 1 down. 2 more to go. It's not very often that you perform the same procedure on 3 animals back to back, and so we're able to perform almost a bit of a production line, really. All right, so if you girls want to swap ferrets, and other things I've never said to you before, there we go. Probably a little bit like building flat pack furniture. The first one makes you swear and curse and take ages. The second one runs much smoother. Good. Okay, number 2 done, 3rd to go.
Little Harry, your turn.
The structures that we're dealing with here are the same as they would be in a dog or a cat or many other mammals. And it's just a case of relating your skills to a smaller creature. So I just am doing a little bit more squinting than normal. It's that little 1 centimetre long piece of that vas deferens. So hopefully it won't ever reattach to allow this ferret to be a dad. Okay. So there we have 3 vasectomized ferrets. All right, let's wake this boy up. My stroke count on ferret vasectomies has gone from 0 to 3. So yeah, it's good. Done well.
How long do you think he's going to be now?
Don't know. Not too long, I hope.
At the Isleworth clinic, Angela and her daughter Emma have arrived to collect 9-year-old Jessie.
I've just been really anxious to hear that he's okay and it's gone well. So hopefully Scott will tell us it has.
Come on then. Good boy. Oh, you're keen. Wait a minute.
Yesterday, the aging Labrador had surgery to remove some suspicious lumps.
Oh, the waggy tail's back. That's good.
Let's have a look at you. Oh,
Come
my
here.
goodness.
A little bit of saggy skin where the
yeah.
massive lump came out. It was
Yes.
like
Oh,
about
gosh.
that
Yes.
big.
Oh, was it?
Yeah. Then removed the one further
Yeah.
down, which was the sort of next
Yeah.
biggest one. And then got to the one at the back, which I was concerned about.
Yes.
What was there was actually attached to the popliteal lymph node, but not actually part of it.
Right.
So we'll wait and see what the lab has to say about it. But I'm feeling fairly confident about that one.
Good. Aren't you a lucky boy, eh? You've been all sorted out. Yes.
I know that Jesse is very happy to go home with Angela and Emma, and he does have a bit of recuperating to do. He's an old dog and he's been through the works. But I really hope in a few days' time he's going to feel much more comfortable. All the wounds will start to heal and this boy will be on the road to recovery. All right, will you get off and put your young man to bed?
I think so.
Yeah.
Cheerio.
See you later. Bye.
Here we go.
Bye, mate. Hey, Laura.
Hiya.
Your eyes?
Yes, thank you. How
Here's
are
your
they?
boys. Yeah, they did so well. They were very, very brave and surgery went well. So
Good.
I'm hopeful that you shouldn't hear the pitter-patter of tiny ferret feet
Fingers
anytime
crossed.
soon. Yeah.
Laura has also returned to the Isleworth clinic to collect her ferrets after their vasectomy surgery.
Do you want to just have a quick look and have a look at the handiwork? Who wants to come out?
I'm sure
Hello, you.
Neville will be happy to come out.
Come on. Hey.
Aw,
Showing.
hello. It was very nerve-wracking. I did miss them. It was very quiet in the house today, but I was very glad to get the call to say they were all good, and it was good to come and get them.
So you can see there's two little suture lines there. The stitches are under the skin, so that'll mean that they're away from prying little ferret teeth, and obviously a little bit of swelling, which is understandable. But given a few days, hopefully they'll be back to normal, and then 6 weeks' time they'll be able to be introduced to their female friends.
Okay.
Yeah. Hey. So I must say I've fallen in love with them a little bit, with their personalities.
Yeah.
Their smell, not so much.
I'm glad Neville's managed to win Scott over. Lots of people think of ferrets as quite snappy, not really very cuddly, but I'm glad that they've won him over and he's had a good experience with them. Hey, mister. What have they done to you?
Good boy. Yes, you are. Yes, you're a good boy. You. Well,
Put him back.
yeah, it's been an interesting day. Vasectomizing ferrets is not something you do every day.
Yeah, not every day.
No.
Okay.
Bye, chaps. Don't hold it against me. Yeah. Especially now you know where I live.
Yeah.
All right, take
Thank
care.
you. Thank
All
you
the
very
best,
much.
Laura.
Bye-bye.
Bye. Bye, boys.
Three months later,
Oliver, we're back. It's all about you today to see the doctors. Your turn.
Matt, Megan and Oliver are back at the Richmond clinic for a checkup.
Yes, and we've got a new addition this time. You can show off your new little sister. Oliver had his surgery, and then our daughter arrived probably 8 weeks afterwards. So there was a short time period for him to recover, but he's been back to his normal self. And it was great when we first took him off the leash after the 10-week recovery to see how he was going to do. And he just took off running, ran up to everybody to say hello and look at my new knees.
Hello, guys. How are you? Hi. Good to see you. Congratulations, I see.
Oh, thank
well
you.
done.
Thank
well
you.
done. Hello, mate. Is this your little sister?
Yeah. Say, I'm a big brother now.
Oh, congratulations. So how's it been going?
Good. Yeah, we've been really pleased with his recovery, and seeing him run around and act back to normal has been fantastic.
Oh,
so.
good. Well, he's certainly the friendly, happy self that he's always been.
Oh,
Can I have a
yes.
little feel of your knees, my friend? Can I feel my handiwork?
Yes.
Can I?
Saying thank you.
Let's have a little feel. So the good news is the knees are finally sitting where they should. The patella, the kneecap, is nicely central and not popping out anymore, so that's great.
Oh, fantastic.
Shall we see my handiwork in action?
Yes. Show off your new knees.
Go on then. Do you want to pop them on the floor for me? Good boy. I'm very happy. Both the knees are sitting beautifully in the groove. The knees seem comfortable. Oliver seems happy. Hey, that's good, isn't it?
What do you think?
Yeah, nice equal weighting on each leg. He's shrugged off the lameness and now he's walking very well and he's back to his happy self. All right, well, I'm very happy with your little legs, hey, which is good, just so he can chase after his little sister.
Thank you so much.
Head off. There's your old baby.
Aw,
good luck with your new baby.
Thank you.
Really appreciate it. No worries, Matt. Good to see you, Megan. Take care. Bye, guys. Ah, happy families.
You can go off in a minute, run about.
And after undergoing marathon surgery to remove several suspicious lumps, Jesse is back enjoying plays in the park with his delighted owners, Angela and Emma.
Should we have a run about? Yeah, on a fetch?
He's really keen to go on his walks again because he was a bit reluctant before, wasn't he?
Yes.
Certainly a few days after the operation, he had no interest in going out whatsoever. He just was lying on the sofa. So now he really looks forward to his walks.
That's a good boy.
Today, Scott is checking up on the 9-year-old Labrador and delivering the all-important test results.
Hello, ladies. How are you?
Hello, Scott. How are you?
Good. Hello, buddy.
Here's our boy.
Jesse, gonna come see me? Hello, boy. How are you?
Who's that?
Hello, mate. How are you? Oh, it's so good to see you. Wow, he is a happy lad, hey?
He is,
Much happier.
He's completely transformed.
Yeah,
He's having a nice time.
Yeah, good. Well, I mean, obviously it was a big surgery
Yes.
that he went through. How's he been afterwards?
Much better. Really good, yeah. He can walk much better, he's happier. Yeah, he's much more enthusiastic to go out.
Great.
Great relief.
Well, let's have a little feel
Good dog.
that surgical site. And wow, I mean, the difference is incredible. I mean, he actually has a perfectly formed armpit there now. You can really feel that. And as a result, without that
See
there.
the difference. Yeah, it's tremendous.
Yeah, well, let me have a little feel of the little area at the back there, because that was where we had the real concern regarding his future. And good news is that it's come back as just a fatty growth, completely benign.
Thank goodness for that. Oh, my goodness. Yes.
That's really good.
We were so worried about that.
Yeah.
Yeah. Oh, that's fantastic.
It's such a big relief because we were worried about a couple of them. Scott was as well, I think. So yeah, it's really good news.
Still wagging his tail, aren't you, mate? Hey? Well, I want to see you running around like a puppy again, hey? Can we see you chase that ball again? Can we? Look at him go.
I know.
Really fast now.
It's really fast, Jen.
Yeah.
Oh, bless
He
him.
hasn't run around like that, for a couple of months.
Good lads.
Come on, run.
Without the ball.
Not the ball.
No. I can fix some things, but not everything.
Jesse.
Seeing Jesse running around the park, he just seems so much more comfortable after the surgery. Now I've been able to remove that, well, it was like a grapefruit-sized lump from underneath his armpit. He's been able to place his legs in a forward direction. Before, he was throwing them around, making him quite uncomfortable, leading to more pain associated with old joints. But now, he's running around like a puppy again.
Good boy.
Good boy.
Oh, it's so wonderful.
Look at
to
that.
see
He's
him
like
running
a
about.
spring lamb, isn't he? Hey? You good boy.
It's marvellous to see him, back to normal.
Good boy.
You've got yourself a job for the whole day, though.
Well done. Good boy. He's a good boy. Yay. Good boy. A few more years in the old boy yet.
Jesse, come on.